Hi, it's Dr. Steve Weiner, and what I'm going to do today is show you tattoo removal. And I love this new laser called the Piqo4 laser because it has 4 wavelengths and very high power. And this tattoo over here, we've already treated it only once. And you can see most of the black is gone, and now there's red and greens. So what we're going to do is we're actually going to treat this with 3 different wavelengths. We're first going to treat it with a 1064 laser, and that's going to treat the remainder of the black. Then we're going to come on in and treat it with a 532 laser, and that's going to hit the reds. And then we're going to hit it with a 650 laser, and that's going to hit the greens. So she's had topical on to numb it, and we're ready to go. So Brittany is our tattoo expert, and she's going to show us how it goes. It goes very quickly. And we're doing all the blacks right now. And there's not much black, so there we go. So the thing that we do here that's different than other offices is we use the R0 protocol. So what Brittany's going to get up is she's going to get up this lotion that we put on the tattoo, and it takes out some of the frosting that occurs. So it allows us to do further treatments of the tattoo. So now we have to recalibrate the laser, so it's going to be a 532 for the reds. So I'll kind of talk while we're calibrating. So typically tattoos require multiple treatments, sometimes 8 to 10 treatments. Our laser has both nanosecond, which is a Q-switch laser, as well as picosecond, which is even faster laser. And so we get faster clearance of these tattoos than most lasers. There's a lot of pico lasers on the market, but after doing my research, I felt that this was the best because it has the highest power, largest ability to, the biggest ability to change the spot size to the largest spot size. Larger spot sizes are safer, and it has 4 different wavelengths. So we're now ready to start with the 532 laser on the reds. And we're good. To keep safety in mind, we always do a little test spot to see if the skin reacts appropriately, and then we'll treat it. So we're treating at a very low setting right now. We'll see how the skin reacts, and then we could increase it if we need to get the appropriate change. So we're going to okay. So part of this is we ask the patient, did you feel that much? She did. Let's treat it at this setting, okay? Okay, so we do it at 10 times per second. The laser goes off at 10 times per second. And we're going to treat the reds right here. And you'll see how fast this goes. And you can see what happens when you treat a tattoo is that the tattoo frosts up. And that's a great reaction that we like to see. And what we're going to do is we're going to put the lotion on it one more time. You can see down here that the black ink is nearly gone from our prior treatments. And we're going to do one more pass with the 532 laser on the red. And because of the large spot size, it goes very quickly, and it's safer as well. So there we go. So we're done with the reds. Now we're going to switch over to the green. So now we're treating the greens with the 650 wavelength. Alright, so then you have to assess the skin and feel. There usually is a little bit of swelling we get. And let's do the R0 protocol. So the R0 protocol gets rid of the frosting that occurs, so it allows us to make further treatments. And we'll do one more pass on that. Okay, So that's about it for treating this tattoo. We treated it with 3 different wavelengths. You notice there's no blistering. If there's blistering, there's ultimately possibly going to be some scarring. So we like to not see blistering. And all 3 different colors were treated with the same laser in a matter of about 5 minutes, which is pretty good. Not many lasers can do that. So it's a Piqo4 laser, high power, multiple wavelengths, large spot sizes. That's key to removing tattoos. Thank you.